Question 1. Strategic planning requires a proactive and personalized approach to fostering long-term client engagement and loyalty within a holistic nutrition practice. Which of the following strategies best embodies this principle for optimizing client relationships and retention? Option A. Relying on generic, one-size-fits-all newsletters and social media posts to maintain client awareness, without specific individual outreach or personalized communication. Option B. Primarily focusing on automated email campaigns that announce new service offerings and discounts, with outreach only occurring when a client's service package is nearing expiration. Option C. Implementing a structured system for regular, personalized follow-ups that go beyond immediate nutritional advice, incorporating check-ins on overall well-being, actively soliciting feedback, and offering relevant educational resources tailored to individual client progress and interests. Option D. Waiting for clients to initiate contact with concerns, or to express dissatisfaction before scheduling follow-up sessions, or offering additional support. Correct answer is C. Implementing a structured system for regular, personalized follow-ups that go beyond immediate nutritional advice, incorporating check-ins on overall well-being, actively soliciting feedback, and offering relevant educational resources tailored to individual client progress and interests. Explanation. This scenario is professionally challenging because building and maintaining strong client relationships is fundamental to a holistic nutrition practice, directly impacting client adherence, outcomes, and the sustainability of the practice. The BCHN credential signifies a commitment to ethical and effective client care, which includes robust relationship-building strategies. The core of this challenge lies in balancing personalized care with efficient practice management, ensuring that client retention efforts are both genuine and sustainable. The correct approach represents best professional practice because it prioritizes a proactive, personalized, and value-driven strategy for client engagement. This involves understanding individual client needs beyond the immediate nutritional plan, fostering trust through consistent communication and demonstrated expertise, and actively seeking feedback to adapt services. Such an approach aligns with the ethical principles of client-centered care, promoting long-term well-being and adherence, which are implicit in the scope of practice for a board-certified holistic nutrition professional. It also supports the development of a strong professional reputation through positive word-of-mouth and client loyalty, contributing to practice growth in an ethical and sustainable manner. An incorrect approach that focuses solely on transactional interactions, such as only reaching out when a renewal is due or when a new service is being pushed, fails to cultivate a genuine relationship. This can be perceived as self-serving and may lead to client disengagement, as it lacks the consistent, supportive presence expected in holistic care. Ethically, this approach neglects the ongoing support and guidance that clients may require between formal sessions, potentially impacting their health outcomes and undermining the holistic philosophy. Another incorrect approach that relies heavily on generic, automated marketing without personalization overlooks the unique journey and needs of each client. While efficiency is important, a lack of individual attention can make clients feel like a number rather than a valued individual. This can lead to decreased trust and a feeling that the practitioner is not truly invested in their personal success, which is a cornerstone of holistic nutrition. This approach can also inadvertently lead to misinterpretations of advice if not tailored to the client's specific context, potentially creating ethical concerns around the appropriateness of guidance. A third incorrect approach that involves solely reactive problem solving, waiting for clients to express dissatisfaction or to leave before attempting to re-engage, is a significant failure in client relationship management. This reactive stance misses opportunities to proactively address potential issues, build rapport, and demonstrate commitment. It suggests a lack of ongoing care and can lead to a perception that the practitioner is only interested in addressing problems rather than fostering continuous growth and well-being. This can also lead to missed opportunities to gather valuable feedback that could improve services for all clients. Professionals should employ a decision-making process that begins with understanding the core principles of holistic nutrition and client-centered care. This involves recognizing that building trust and rapport is an ongoing process, not a one-time event. A systematic approach to client relationship management should include regular, personalized check-ins, proactive communication about relevant health information, opportunities for clients to provide feedback, and a genuine interest in their long-term success. This framework ensures that client retention is a natural outcome of providing exceptional, ethical, and personalized holistic nutrition services. Question 2. Compliance review shows a holistic nutrition professional is working with a client who reports significant work-related stress, stating, "I find myself craving unhealthy foods and overeating when I'm particularly overwhelmed, and I'm not sure how to stop." The professional needs to determine the most appropriate next step in supporting this client's holistic well-being. Option A. Advise the client that stress is a common issue and not directly related to nutrition, suggesting they focus solely on adhering to a standard healthy eating plan without further discussion of their stress. Option B. Immediately provide the client with a detailed meal plan designed to combat stress-induced cravings and offer techniques for emotional regulation, assuming the stress is the primary driver of their nutritional challenges. Option C. Diagnose the client with a stress-related eating disorder and recommend specific therapeutic exercises to address the underlying psychological condition. Option D. Acknowledge the client's stress and its impact on eating habits. Explore the specific nature of the stress and its perceived connection to food choices through further questioning. And assess if nutritional strategies can support stress management while planning for a referral to a licensed mental health professional if indicated by the assessment. Correct answer is D. Acknowledge the client's stress and its impact on eating habits. Explore the specific nature of the stress and its perceived connection to food choices through further questioning. And assess if nutritional strategies can support stress management while planning for a referral to a licensed mental health professional if indicated by the assessment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a holistic nutrition professional to navigate the complex interplay between a client's psychological state and their nutritional choices, while adhering strictly to the scope of practice defined by the board certified in holistic nutrition (BCHN) standards. The challenge lies in recognizing the mind-body connection without overstepping into areas requiring licensure as a mental health professional. Accurate assessment and appropriate referral are paramount to client safety and professional integrity. Correct approach analysis. The correct approach demonstrates best professional practice by acknowledging the client's reported stress and its potential impact on their eating habits. It prioritizes gathering more information to understand the nature and severity of the stress and its perceived connection to nutrition. Crucially, it includes a plan for referral to a licensed mental health professional if the assessment indicates the need for specialized support beyond the scope of holistic nutrition. This aligns with BCHN ethical guidelines, which emphasize client well-being, scope of practice limitations, and the importance of interdisciplinary collaboration when necessary. The focus remains on nutritional strategies that can support stress management within the holistic nutrition framework, while ensuring the client receives appropriate care for their mental health. Incorrect approach is analysis. One incorrect approach fails by directly offering psychological counseling or therapeutic interventions for stress. This is a clear violation of the BCHN scope of practice, as holistic nutrition professionals are not licensed to provide mental health therapy. Such an approach could lead to harm if the client's condition requires professional psychological treatment that is not provided. Another incorrect approach is to dismiss the client's reported stress as irrelevant to their nutritional goals. This ignores the fundamental principle of the mind-body connection, a core tenet of holistic nutrition. It demonstrates a lack of comprehensive client assessment and fails to address potential underlying factors influencing nutritional adherence and overall well-being, thereby not providing truly holistic care. A further incorrect approach involves making definitive diagnoses of mental health conditions based solely on reported stress. Holistic nutrition professionals are not qualified to diagnose mental health disorders. This overreach constitutes practicing outside of one's scope and could lead to misdiagnosis and inappropriate nutritional recommendations, potentially delaying or hindering the client from seeking necessary professional mental health care. Professional reasoning. Professionals should approach such situations by first actively listening and validating the client's experience. They must then conduct a thorough assessment that explores the perceived connection between the client's stress and their nutritional habits, always within the defined scope of holistic nutrition. If the assessment reveals significant psychological distress or a potential need for mental health intervention, the professional's primary responsibility is to facilitate a referral to a qualified mental health professional. They should then focus on providing nutritional support that is complementary to any mental health treatment, always maintaining clear boundaries regarding their professional expertise. Question 3. Benchmark analysis indicates that a client is seeking guidance on optimizing their gut microbiome for improved overall health, expressing interest in specific probiotic supplements and the potential for these to address various health concerns. As a board-certified in holistic nutrition (BCHN) professional, which approach best aligns with regulatory requirements and ethical practice? Option A. Suggest a highly restrictive elimination diet targeting common gut irritants, without a comprehensive assessment or medical referral, to rapidly alter the client's gut flora. Option B. Recommend a specific brand of probiotic and prebiotic supplements that are widely marketed for gut health, advising the client to take them consistently to address their stated health concerns. Option C. Educate the client on the foundational principles of gut health, including dietary strategies like increasing fiber intake and consuming fermented foods, while recommending they consult with their physician or a registered dietitian for personalized advice on specific supplements and any medical conditions. Option D. Advise the client that manipulating the gut microbiome through specific dietary changes alone is a guaranteed method to cure common ailments such as digestive discomfort and fatigue. The correct answer is C. Educate the client on the foundational principles of gut health, including dietary strategies like increasing fiber intake and consuming fermented foods, while recommending they consult with their physician or a registered dietitian for personalized advice on specific supplements and any medical conditions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a holistic nutrition professional to navigate the complex and evolving understanding of the gut microbiome's impact on overall health, while adhering strictly to the scope of practice and ethical guidelines set forth by the Board Certified in Holistic Nutrition (BCHN). The challenge lies in distinguishing between evidence-based nutritional interventions and unsubstantiated claims, particularly when dealing with a topic that has gained significant public attention but also attracts misinformation. Professionals must exercise careful judgment to provide safe, effective, and ethical guidance that aligns with the BCHN regulatory framework. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client safety and evidence-based recommendations within the defined scope of holistic nutrition. It involves a comprehensive assessment of the client's current dietary habits, lifestyle, and health status to identify potential areas for improvement that can positively influence the gut microbiome. This approach emphasizes education on foundational principles of gut health, such as increasing fiber intake, consuming fermented foods, and managing stress, all of which are within the purview of a holistic nutritionist. Furthermore, it involves recommending consultation with a qualified healthcare provider for any medical diagnoses or treatment plans, thereby respecting professional boundaries and ensuring comprehensive client care. This aligns with the BCHN commitment to ethical practice and client well-being by avoiding overstepping professional boundaries and promoting a collaborative approach to health. Incorrect approaches analysis. One incorrect approach involves recommending specific, unproven probiotic strains or probiotics without sufficient scientific evidence or a thorough understanding of the client's individual microbiome profile. This is a regulatory and ethical failure because it constitutes offering advice beyond the scope of practice for a holistic nutritionist, potentially leading to ineffective or even harmful outcomes for the client. It bypasses the necessary medical evaluation and personalized approach required for such interventions, violating the principle of do no harm and potentially misrepresenting the efficacy of these supplements. Another incorrect approach is to make definitive claims about curing specific diseases or conditions solely through dietary manipulation of the gut microbiome. This is a significant ethical and regulatory failure, as it constitutes unsubstantiated health claims, which are prohibited. Holistic nutrition professionals are not licensed to diagnose or treat diseases. Making such claims can mislead clients, delay appropriate medical treatment, and damage the reputation of the profession. It violates the BCHN guidelines on professional conduct and responsible practice. A third incorrect approach involves recommending drastic dietary restrictions or elimination diets without proper assessment and supervision, solely based on generalized information about gut health. This can lead to nutritional deficiencies, disordered eating patterns, and a negative impact on the client's overall health. It represents a failure to adhere to best practices in nutritional counseling, which requires individualized assessment and a balanced approach, and can be seen as practicing outside the scope of safe and ethical holistic nutrition guidance. Professional reasoning. Professionals should approach client inquiries about the gut microbiome by first conducting a thorough client assessment. This includes understanding their current diet, lifestyle, symptoms, and any existing medical conditions. They should then focus on educating the client about general principles of gut health supported by robust scientific evidence, such as the importance of a diverse diet rich in fiber, fermented foods, and adequate hydration. Professionals must clearly define the boundaries of their practice, emphasizing that they provide nutritional guidance and support, not medical diagnoses or treatments. When specific interventions like probiotics or prebiotics are discussed, the professional should encourage consultation with a physician or registered dietitian to ensure they are appropriate and safe for the individual client. This decision-making process prioritizes client safety, ethical conduct, and adherence to the BCHN regulatory framework by focusing on education, evidence-based general recommendations, and appropriate referral when necessary. Question 4. Consider a scenario where a client presents with a genetic report indicating a common polymorphism in the MTHFR gene, suggesting a potential alteration in folate metabolism. The client is seeking personalized nutritional guidance to optimize their energy levels and cognitive function. As a board-certified in holistic nutrition, BCHN professional, what is the most appropriate approach to address this information within the context of nutritional biochemistry? Option A. Base nutritional recommendations solely on popular online articles and anecdotal reports linking MTHFR polymorphism to specific dietary interventions and supplements. Option B. Integrate the MTHFR polymorphism information with a comprehensive dietary assessment, symptom analysis, and consideration of other relevant biochemical markers to develop a personalized, evidence-based nutritional plan that may include dietary adjustments and targeted supplementation if indicated. Option C. Advise the client that MTHFR gene variations are not clinically significant for nutritional recommendations and disregard the genetic report entirely. Option D. Immediately recommend a high-dose methylated folate supplement to address the perceived folate deficiency, without further investigation into the client's diet or other metabolic factors. The correct answer is B. Integrate the MTHFR polymorphism information with a comprehensive dietary assessment, symptom analysis, and consideration of other relevant biochemical markers to develop a personalized, evidence-based nutritional plan that may include dietary adjustments and targeted supplementation if indicated. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a holistic nutrition professional to navigate the complex interplay between a client's genetic predispositions, their current dietary intake, and the biochemical pathways involved in nutrient metabolism. The challenge lies in interpreting scientific literature accurately, applying it to an individual's unique biochemistry without overstepping professional boundaries, and communicating findings effectively and ethically to the client. The risk of misinterpretation or making unsubstantiated claims is high, necessitating a rigorous, evidence-based, and client-centered approach. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment rooted in established nutritional biochemistry principles and current scientific evidence. It acknowledges the client's genetic information as one piece of a larger puzzle, integrating it with detailed dietary analysis and symptom evaluation. This approach aligns with the ethical guidelines of the board certified in holistic nutrition, BCHN, which emphasize evidence-based practice, client autonomy, and the avoidance of unsubstantiated claims. By focusing on observable biochemical markers and functional assessments, the professional can develop targeted, actionable recommendations that are safe and effective, respecting the client's right to informed consent and avoiding the promotion of unproven interventions. This method upholds the professional's responsibility to provide competent and ethical care. Incorrect approach is analysis, an approach that solely focuses on a single genetic marker and immediately recommends specific, high-dose supplements without considering the client's overall diet, lifestyle, or other biochemical data is ethically and professionally flawed. This is a form of reductionism that ignores the systemic nature of health and nutrition. It risks creating nutrient imbalances, potentially causing harm, and making unsubstantiated claims about the efficacy of supplements based on limited evidence. This approach fails to adhere to the BCHN emphasis on holistic assessment and evidence-based practice, potentially violating ethical standards regarding client safety and responsible practice. An approach that dismisses the client's genetic information entirely, stating it is irrelevant to nutritional recommendations, is also problematic. While genetic information should not be the sole determinant, it can provide valuable insights into potential metabolic variations and predispositions. Ignoring this data point, especially when the client has provided it, can lead to a less personalized and potentially less effective nutritional plan. It may also fail to meet the client's expectations for a comprehensive, individualized assessment, potentially undermining the professional-client relationship and the holistic nature of the practice. An approach that relies heavily on anecdotal evidence or popular trends related to specific genetic profiles, without consulting peer-reviewed scientific literature or established biochemical pathways, is a significant ethical failure. This practice is not evidence-based and can lead to the promotion of ineffective or even harmful interventions. It disregards the rigorous standards expected of a board-certified professional and can mislead the client, eroding trust and potentially causing harm. This approach directly contravenes the BCHN commitment to scientific integrity and evidence-based practice. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough client intake, encompassing medical history, current diet, lifestyle, symptoms, and any available diagnostic information, including genetic data. This data should then be critically evaluated against established principles of nutritional biochemistry and current peer-reviewed scientific literature. The professional must identify potential biochemical imbalances or predispositions that may be influenced by nutrition. Recommendations should be developed collaboratively with the client, focusing on evidence-based dietary strategies, lifestyle modifications, and targeted supplementation only when clearly indicated and supported by scientific evidence and functional assessments. The process must always prioritize client safety, informed consent, and the avoidance of unsubstantiated claims, ensuring that all recommendations are integrated into a holistic plan that respects the client's individual needs and goals. Question 5. The investigation demonstrates a client presenting with symptoms they attribute to toxins and requesting specific dietary protocols to detoxify their body. The holistic nutrition professional is asked to outline a plan. Which of the following represents the most appropriate and ethically compliant course of action according to the board certified in holistic nutrition, BCHN, framework? Option A. Provide a detailed meal plan that eliminates all common allergens and processed foods, claiming this will directly address the client's detoxification concerns without requiring medical consultation. Option B. Design a strict, short-term detox diet plan featuring specific elimination foods and potent herbal supplements to rapidly clear toxins from the client's system. Option C. Educate the client on general principles of supporting the body's natural detoxification pathways through a balanced, whole foods diet, and recommend they consult with a licensed healthcare provider for diagnosis and management of their symptoms. Option D. Advise the client that their symptoms are likely psychosomatic and that no specific nutritional intervention is necessary. The correct answer is C. Educate the client on general principles of supporting the body's natural detoxification pathways through a balanced, whole foods diet, and recommend they consult with a licensed healthcare provider for diagnosis and management of their symptoms. Explanation. The investigation demonstrates a scenario where a holistic nutrition professional is asked to provide specific dietary recommendations for a client presenting with symptoms suggestive of impaired detoxification. This situation is professionally challenging because it borders on the practice of diagnosing and treating medical conditions, which falls outside the scope of practice for a holistic nutrition professional under the board certified in holistic nutrition, BCHN framework. The BCHN certification emphasizes education and guidance on nutrition for wellness and support, not medical intervention. The correct approach represents best professional practice because it adheres strictly to the BCHN scope of practice and ethical guidelines. It involves acknowledging the client's concerns, educating them on general principles of nutritional support for detoxification pathways, and crucially, recommending they consult with a qualified healthcare provider for diagnosis and medical management. This upholds professional integrity, ensures client safety by directing them to appropriate medical care, and avoids the unauthorized practice of medicine. An incorrect approach that involves directly recommending specific detox diets or supplements without a medical diagnosis from a licensed practitioner is a significant regulatory and ethical failure. This could be construed as diagnosing or treating a medical condition, which is outside the BCHN scope and potentially violates state or federal regulations regarding the practice of nutrition and medicine. It also poses a risk to the client's health if their symptoms are indicative of a serious underlying medical issue that requires conventional medical treatment. Another incorrect approach, such as dismissing the client's symptoms entirely, is ethically problematic as it fails to acknowledge the client's expressed health concerns and misses an opportunity to guide them toward appropriate care. The professional decision-making process for similar situations should involve a clear understanding of the BCHN defined scope of practice. When a client presents with symptoms that could indicate a medical condition, the professional's primary responsibility is to guide the client toward appropriate medical evaluation. This involves active listening, empathetic acknowledgement of their concerns, providing general, evidence-informed nutritional information relevant to supporting bodily functions, and making a clear, unambiguous referral to a licensed healthcare provider for diagnosis and treatment. The professional should document all interactions and recommendations, particularly any referrals made. Question 6. Upon reviewing a new client's intake form, a holistic nutrition practitioner notes that the client reports experiencing immediate and severe gastrointestinal distress, hives, and difficulty breathing after consuming dairy products. The client states they have a dairy sensitivity and have been avoiding dairy for the past year, but their symptoms persist intermittently even with minimal exposure. The client is seeking guidance on a comprehensive dietary plan to address this issue and improve their overall well-being. Option A. Recommend a detailed elimination diet protocol focusing on identifying other potential trigger foods, while advising the client to continue strict dairy avoidance and monitor symptoms. Option B. Explain the critical difference between food sensitivities and allergies. Strongly recommend the client seek immediate medical evaluation from a physician or allergist for proper diagnosis and management of a potential food allergy, and offer to support them with general nutritional strategies once a medical diagnosis is established. Option C. Suggest a series of probiotic and enzyme supplements that may help the client digest dairy more effectively, allowing them to reintroduce small amounts of dairy into their diet. Option D. Advise the client that their symptoms are likely a mild sensitivity and provide a list of dairy-free alternatives and recipes to incorporate into their diet. The correct answer is A. Recommend a detailed elimination diet protocol focusing on identifying other potential trigger foods, while advising the client to continue strict dairy avoidance and monitor symptoms. Explanation. This scenario presents a professional challenge due to the critical distinction between food sensitivities and food allergies, particularly in the context of holistic nutrition practice. Misinterpreting these conditions can lead to ineffective or even harmful recommendations. A holistic nutritionist must operate within their scope of practice, which generally excludes diagnosing medical conditions or prescribing medical treatments. The primary ethical and regulatory imperative is to ensure client safety and to refer to appropriate medical professionals when necessary. The correct approach represents best professional practice because it prioritizes client safety and adheres to the scope of practice for a holistic nutritionist. By recognizing the limitations of their expertise in diagnosing and managing severe allergic reactions, the professional appropriately refers the client to a physician for definitive diagnosis and medical management. This aligns with ethical guidelines that emphasize acting in the client's best interest and avoiding the practice of medicine without a license. Furthermore, it respects the established medical framework for managing potentially life-threatening conditions. An incorrect approach that involves attempting to diagnose or manage a suspected food allergy without medical referral is a significant regulatory and ethical failure. This could be construed as practicing medicine without a license, which is illegal and dangerous. It also violates the principle of do no harm by potentially delaying proper medical intervention, which could have severe consequences for the client. Another incorrect approach, such as providing extensive dietary protocols for a suspected allergy without medical confirmation, risks mismanaging the client's condition, leading to nutritional deficiencies or continued adverse reactions, and overstepping the nutritionist's scope. The professional decision-making process for similar situations should involve a clear understanding of the difference between sensitivities and allergies, recognizing the signs and symptoms that warrant medical attention, and maintaining a strong referral network. When faced with a situation where a client presents with symptoms suggestive of a food allergy, the professional should first assess the severity and nature of the symptoms. If there is any indication of a potential immediate allergic reaction, e.g., hives, swelling, difficulty breathing, anaphylaxis, immediate referral to a physician or allergist is paramount. For suspected sensitivities, while a holistic nutritionist may offer general dietary support and elimination diet guidance, it is crucial to emphasize that this is not a substitute for medical diagnosis and management of allergies. The professional should always document their assessment, recommendations, and referrals thoroughly. Question 7. The performance metrics show a significant drop-off in client engagement with food journaling after the initial 2 weeks of a new dietary analysis program. Several clients have expressed difficulty in consistently recording their intake, citing time constraints and forgetfulness. As a board-certified in holistic nutrition, BCHN professional, what is the most appropriate strategy to address this implementation challenge and ensure the continued effectiveness of dietary analysis? Option A. Schedule a follow-up session to collaboratively explore the specific barriers to journaling, educate the client on the direct impact of accurate journaling on personalized recommendations, and offer a range of flexible journaling tools, e.g., mobile apps, photo logs, simple written lists, to find a method that best suits their lifestyle and preferences. Option B. Discuss the challenges encountered by these clients with other nutrition professionals in a peer-to-peer consultation group to seek general advice on improving client adherence to journaling. Option C. Assume that the clients are not sufficiently motivated to make the necessary lifestyle changes and suggest pausing the journaling component of the program until they express a stronger commitment. Option D. Reiterate the importance of food journaling during the next scheduled appointment, emphasizing that consistent adherence is non-negotiable for progress, and provide a standardized template for them to use moving forward. The correct answer is A. Schedule a follow-up session to collaboratively explore the specific barriers to journaling, educate the client on the direct impact of accurate journaling on personalized recommendations, and offer a range of flexible journaling tools, e.g., mobile apps, photo logs, simple written lists, to find a method that best suits their lifestyle and preferences. Explanation. The performance metrics show a consistent challenge in client adherence to food journaling, impacting the effectiveness of dietary analysis. This scenario is professionally challenging because it requires the holistic nutrition professional to adapt their methods to individual client needs and learning styles while maintaining professional standards and client confidentiality. The effectiveness of dietary analysis hinges on accurate and consistent client input, making adherence a critical factor. The correct approach represents best professional practice because it prioritizes client education and collaborative goal setting. By explaining the rationale behind food journaling and its direct link to personalized recommendations, the professional empowers the client, offering flexible journaling methods, e.g., apps, photos, simple lists, acknowledges individual preferences and technological access, thereby increasing the likelihood of sustained engagement. This aligns with ethical principles of client-centered care and the BCHN commitment to evidence-informed practice, which emphasizes the importance of accurate data for effective interventions. Furthermore, it respects client autonomy by involving them in the process of finding a suitable method. An incorrect approach that involves simply reiterating the importance of food journaling without addressing the client's difficulties fails to acknowledge the implementation challenge. This can lead to client frustration and disengagement, undermining the professional relationship and the efficacy of the nutrition plan. Ethically, it can be seen as a failure to provide adequate support and adapt strategies to meet client needs. Another incorrect approach, such as assuming the client is not motivated and discontinuing the journaling requirement without further investigation, is a premature judgment. This overlooks potential barriers the client may be experiencing and can be perceived as a lack of professional diligence. It also fails to uphold the principle of providing ongoing support and guidance. A further incorrect approach, which involves sharing the client's journaling difficulties with other professionals without explicit consent, constitutes a breach of client confidentiality. This is a serious ethical and regulatory violation, as all client information must be protected. The professional decision-making process for similar situations should involve active listening to understand the client's specific barriers to food journaling. This should be followed by a collaborative discussion to explore alternative methods that are more manageable for the client. The professional should then clearly explain how the chosen method will contribute to achieving the client's health goals, reinforcing the value of their participation. Ongoing check-ins and adjustments to the journaling method based on client feedback are crucial for sustained success. Question 8. Examination of the data shows a client seeking to manage chronic inflammation through dietary means. As a board-certified and holistic nutrition professional, you are considering advising on the integration of phytochemicals. Which of the following approaches best aligns with evidence-based practice and professional ethical guidelines for managing such a client? Option A. Suggest the client exclusively consume a single miracle food product marketed for its potent phytochemical content, as it is advertised to rapidly resolve inflammatory markers. Option B. Recommend a specific, high-potency concentrated extract of a single phytochemical, citing a recent popular health blog's endorsement for its anti-inflammatory properties. Option C. Focus on a commercially available detox tea blend that claims to be packed with various phytochemicals, without verifying the specific compounds or their scientifically supported efficacy for inflammation. Option D. Advise the client to increase their intake of a wide variety of colorful fruits and vegetables known to be rich in diverse phytochemicals, emphasizing whole food sources and their synergistic benefits, while considering the client's individual dietary habits and preferences. The correct answer is D. Advise the client to increase their intake of a wide variety of colorful fruits and vegetables known to be rich in diverse phytochemicals, emphasizing whole food sources and their synergistic benefits, while considering the client's individual dietary habits and preferences. Explanation. Scenario analysis. A holistic nutrition professional is tasked with advising a client on incorporating phytochemicals into their diet to manage a chronic inflammatory condition. The challenge lies in navigating the vast and sometimes conflicting information available on phytochemicals, ensuring recommendations are evidence-based, safe, and aligned with the client's individual needs and the scope of practice for a board certified in holistic nutrition, BCHN. Misinformation or unsubstantiated claims about specific phytochemicals can lead to ineffective or even harmful dietary interventions, underscoring the need for a rigorous, evidence-informed approach. Correct approach analysis. The correct approach involves a comprehensive review of current scientific literature and established guidelines regarding phytochemicals and their role in managing inflammation. This includes understanding the mechanisms of action, bioavailability, potential interactions with medications, and appropriate dosages or food sources. Recommendations should be tailored to the client's specific health status, dietary preferences, and potential sensitivities, always within the BCHN scope of practice, which emphasizes food-based strategies and lifestyle modifications rather than disease treatment. This approach prioritizes client safety, efficacy, and adherence to professional standards by relying on credible scientific evidence and individualized care. Incorrect approaches analysis. Recommending a specific high-dose phytochemical supplement based on anecdotal evidence or a single preliminary study is an ethical and professional failure. This approach bypasses the need for robust scientific validation, potentially exposing the client to unknown risks or interactions, and oversteps the BCHN scope of practice by implying a therapeutic intervention beyond dietary guidance. It also fails to consider individual variability in response and potential contraindications, suggesting the exclusive consumption of a single food rich in a particular phytochemical without considering overall dietary balance or the client's existing dietary patterns is also problematic. This can lead to nutritional deficiencies, dietary monotony, and may not provide the synergistic benefits of a varied diet. It neglects the holistic principle of balanced nutrition and can be impractical for long-term adherence. Focusing solely on the marketing claims of a commercially available superfood blend without independent verification of its phytochemical content or efficacy is a significant regulatory and ethical lapse. This approach relies on unsubstantiated marketing rather than scientific evidence, potentially misleading the client and failing to provide evidence-based nutritional advice. It also risks recommending products with unproven benefits or undisclosed ingredients. Professional reasoning. Professionals should adopt a systematic, evidence-based approach. This involves 1. Thoroughly assessing the client's health status, medical history, and current dietary intake. 2. Conducting a literature review using reputable scientific databases to identify evidence-based information on relevant phytochemicals and their impact on the client's condition. 3. Prioritizing whole food sources of phytochemicals, considering bioavailability and synergistic effects. 4. If supplements are considered, ensuring they are from reputable sources, have third-party testing, and are discussed with the client's healthcare provider, especially if the client is on medication. 5. Continuously educating oneself on the evolving research in the field and maintaining awareness of the BCHN scope of practice. Question 9. Performance analysis shows that a holistic nutrition professional is developing a nutrition plan for a client who is experiencing significant life changes. The professional needs to ensure the plan effectively addresses the client's evolving nutritional requirements. Which of the following represents the most appropriate and ethically sound approach for the professional to take? Option A. Focus exclusively on macronutrient distribution, such as carbohydrate, protein, and fat ratios, without delving into specific micronutrient needs or the impact of lifestyle factors pertinent to the client's current life stage. Option B. Prioritize the recommendation of a broad spectrum of high-dose vitamin and mineral supplements to ensure all potential nutrient gaps are covered, while making only minor adjustments to the client's diet. Option C. Apply a standardized, general nutrition guideline that is widely accepted for adult populations, assuming it will cover most of the client's needs regardless of their specific life stage. Option D. Conduct a comprehensive assessment that considers the client's current life stage, physiological requirements, potential nutrient imbalances, and personal health goals to create a tailored plan. The correct answer is D. Conduct a comprehensive assessment that considers the client's current life stage, physiological requirements, potential nutrient imbalances, and personal health goals to create a tailored plan. Explanation. Scenario analysis. This scenario presents a common challenge for holistic nutrition professionals, adapting nutritional guidance to the unique and evolving needs of different life stages. The difficulty lies in synthesizing broad nutritional principles with the specific physiological, psychological, and social factors that characterize each phase of life, while adhering strictly to the scope of practice and ethical guidelines set forth by the board certified in holistic nutrition, BCHN. Misinterpreting these needs can lead to suboptimal health outcomes and potentially violate professional standards. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the individual's current life stage, their specific physiological requirements e.g., growth, maintenance, decline, potential nutrient deficiencies or excesses common to that stage, and their personal health goals. This approach aligns with the BCHN emphasis on individualized, evidence-informed, and holistic care. It requires the professional to draw upon their knowledge of nutritional science, developmental biology, and the principles of holistic health to create a tailored plan that supports optimal well-being throughout the lifespan, respecting the client's autonomy and promoting sustainable, healthy habits. This is best professional practice as it prioritizes client safety and efficacy by grounding recommendations in a thorough understanding of the client's unique context and the science of nutrition across different life stages. Incorrect approaches analysis. One incorrect approach involves applying a one-size-fits-all nutritional plan without considering the client's specific life stage. This fails to acknowledge the distinct metabolic, hormonal, and physiological changes that occur from infancy through older adulthood. Such an approach is ethically problematic as it does not provide individualized care and could lead to nutrient imbalances or deficiencies that are inappropriate for the client's age and developmental status, potentially contravening the BCHN commitment to client well-being and evidence-based practice. Another incorrect approach is to focus solely on macronutrient ratios without considering micronutrient needs or the impact of lifestyle factors specific to a life stage. For example, focusing only on protein for an athlete without considering calcium and vitamin D needs for bone health in adolescence or older adulthood would be a significant oversight. This approach is incomplete and can lead to health issues that a holistic practitioner should be equipped to address. It demonstrates a lack of comprehensive understanding of nutritional science across the lifespan and a failure to provide truly holistic support. A third incorrect approach is to recommend supplements without a thorough assessment of dietary intake and the client's specific needs for that life stage. While supplements can be beneficial, their indiscriminate use can be costly, ineffective, or even harmful, especially for vulnerable populations like children or the elderly. This approach bypasses the foundational work of optimizing diet and can lead to an over-reliance on external interventions, which is not in line with the holistic principle of addressing root causes and promoting sustainable dietary patterns. It also risks contravening ethical guidelines regarding responsible product recommendations. Professional reasoning. Professionals should approach nutritional needs across the lifespan by first conducting a thorough client assessment that includes their age, physiological status, health history, lifestyle, and personal goals. This assessment should then inform the development of an individualized nutrition plan that addresses the specific nutrient requirements and potential challenges of their current life stage. Continuous learning and staying updated on the latest research regarding nutrition across the lifespan are crucial. Professionals must always operate within their scope of practice, referring to other healthcare providers when necessary, and prioritize client education to empower them to make informed decisions about their health. Question 10. Governance review demonstrates that a holistic nutrition professional is working with an adolescent client experiencing challenges with energy levels and concentration at school. The professional has gathered information on the adolescent's current dietary habits, sleep patterns, and physical activity. Which of the following approaches best aligns with the BCHN regulatory framework and ethical guidelines for supporting this adolescent? Option A. Provide a strict elimination diet to identify potential food sensitivities that may be contributing to the adolescent's symptoms, without first consulting with a physician or registered dietitian. Option B. Create a generic meal plan that outlines specific calorie and macronutrient targets for adolescents, assuming these targets will address the adolescent's energy and concentration issues. Option C. Immediately recommend a specific supplement regimen to boost cognitive function and energy, based on common adolescent deficiencies, without further diagnostic testing or medical consultation. Option D. Develop a personalized nutrition education plan that focuses on nutrient-dense food choices, balanced meal timing, and hydration strategies, while also exploring potential lifestyle factors impacting energy and concentration, and collaborating with the adolescent and their guardians to set achievable goals. The correct answer is D. Develop a personalized nutrition education plan that focuses on nutrient-dense food choices, balanced meal timing, and hydration strategies, while also exploring potential lifestyle factors impacting energy and concentration, and collaborating with the adolescent and their guardians to set achievable goals. Explanation. This scenario presents a professional challenge because it requires a holistic nutrition professional to navigate the complex landscape of adolescent nutrition, while adhering strictly to the board certified in holistic nutrition, BCHN, regulatory framework. The challenge lies in balancing evidence-based nutritional science with the unique developmental, social, and psychological needs of adolescents, all within the ethical and legal boundaries of the profession. Careful judgment is required to ensure recommendations are safe, effective, and culturally sensitive, avoiding any practices that could be misconstrued as medical advice or that overstep the scope of practice for a holistic nutritionist. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that considers the adolescent's entire well-being, not just their dietary intake. This aligns with the BCHN emphasis on a holistic perspective, which integrates physical, mental, emotional, and environmental factors. By focusing on education, skill building, and collaborative goal setting with the adolescent and their guardians, the professional empowers them to make sustainable, healthy choices. This approach respects the autonomy of the adolescent and their family, fostering a trusting relationship and promoting long-term adherence to nutritional recommendations, which is ethically sound and aligns with the BCHN commitment to client-centered care. An incorrect approach that focuses solely on macronutrient ratios without considering the adolescent's lifestyle, food preferences, or potential underlying health concerns is professionally unacceptable. This narrow focus fails to address the root causes of potential nutritional imbalances and can lead to restrictive or unsustainable dietary patterns, potentially causing harm. It also disregards the holistic principles that are foundational to the BCHN certification. Another incorrect approach that involves diagnosing or treating specific medical conditions through dietary interventions without appropriate medical referral is a significant regulatory and ethical failure. Holistic nutrition professionals are not licensed medical practitioners, and attempting to diagnose or treat medical conditions crosses the boundaries of their scope of practice, potentially endangering the adolescent's health and violating professional conduct guidelines. Furthermore, an approach that relies on generalized, one-size-fits-all dietary plans without individualization is also professionally unacceptable. Adolescents are a diverse group with varying needs based on age, activity level, cultural background, and individual health status. Generic advice fails to address these unique needs and can be ineffective or even detrimental. The professional decision-making process for similar situations should involve a thorough intake and assessment process that gathers information on the adolescent's current diet, lifestyle, physical activity, sleep patterns, stress levels, family history, and any specific concerns or goals. This information should then be used to develop a personalized, evidence-based, and holistic nutrition plan in collaboration with the adolescent and their guardians. Professionals must continuously assess their scope of practice, seek appropriate continuing education, and maintain clear boundaries, referring to medical professionals when necessary. Ethical considerations, such as client confidentiality, informed consent, and avoiding conflicts of interest, must guide every interaction. Question 11. Analysis of a pregnant client in her second trimester who reports experiencing persistent nausea and vomiting, along with significant fatigue, which she attributes solely to morning sickness. She is seeking advice on specific dietary changes and herbal supplements to alleviate these symptoms. As a board-certified in holistic nutrition, BCHN professional, what is the most appropriate course of action? Option A. Provide general advice on eating small, frequent meals and staying hydrated, without mentioning the need for medical consultation, as her symptoms are common during pregnancy. Option B. Advise the client that while general nutritional support can be beneficial during pregnancy, her reported symptoms warrant immediate consultation with her obstetrician or midwife to rule out any underlying medical conditions and to receive appropriate medical management. Option C. Suggest that her symptoms are likely due to stress and recommend relaxation techniques and a broad-spectrum multivitamin. Option D. Recommend a strict elimination diet and a proprietary blend of herbal supplements known for their anti-nausea properties, assuring her that these will resolve her symptoms. The correct answer is B. Advise the client that while general nutritional support can be beneficial during pregnancy, her reported symptoms warrant immediate consultation with her obstetrician or midwife to rule out any underlying medical conditions and to receive appropriate medical management. Explanation. This scenario is professionally challenging because it requires a holistic nutrition professional to navigate the complex interplay of individual client needs, evidence-based nutritional science, and the specific regulatory landscape governing their practice. The client presents with a common but potentially serious concern during pregnancy, demanding a nuanced and responsible approach. The professional must balance providing supportive and evidence-informed guidance with recognizing the boundaries of their scope of practice and the importance of interdisciplinary collaboration. The correct approach represents best professional practice because it prioritizes client safety and well-being by adhering to established professional guidelines and regulatory frameworks. It acknowledges the limitations of a holistic nutrition professional's role in diagnosing or treating medical conditions and emphasizes the critical need for collaboration with a qualified healthcare provider. This aligns with ethical principles of non-maleficence and beneficence, ensuring the client receives comprehensive and appropriate care. Specifically, it upholds the BCHN commitment to evidence-based practice and responsible client management, which includes recognizing when to refer to other licensed professionals. An incorrect approach that involves directly recommending specific supplements or dietary interventions to manage the client's reported symptoms without consulting a physician fails to acknowledge the potential underlying medical causes. This could lead to delayed diagnosis and treatment of a serious condition, violating the ethical principle of non-maleficence. Furthermore, It oversteps the professional's scope of practice, potentially contravening regulations that define the boundaries of holistic nutrition practice and requiring licensed medical oversight for certain health concerns. Another incorrect approach, which is to dismiss the client's concerns as non-nutritional and offer no further guidance, is also professionally unacceptable. While it avoids overstepping boundaries, it fails to provide adequate support and guidance to the client, potentially leaving them feeling unheard and unsupported. A holistic approach necessitates addressing the client's concerns comprehensively, even if it involves referral. This approach neglects the principle of beneficence by not actively assisting the client in finding appropriate care. A third incorrect approach, which is to provide general, nonspecific nutritional advice without addressing the reported symptoms or recommending consultation with a healthcare provider, is insufficient. While not directly harmful, it fails to meet the client's immediate need for guidance regarding a potentially serious pregnancy-related issue. This approach lacks the specificity and proactive engagement required for effective client care within the scope of holistic nutrition, particularly when dealing with a vulnerable population like pregnant individuals. The professional decision-making process for similar situations should involve a systematic evaluation of the client's presentation, a clear understanding of one's scope of practice and relevant regulations, and a commitment to client-centered care. This includes active listening to the client's concerns, assessing the potential nutritional components of their situation, and crucially, identifying when medical expertise is required. The professional should then clearly communicate the need for medical consultation, explain the rationale, and offer support in facilitating that connection if possible, while continuing to provide appropriate holistic nutrition guidance within their defined role. Question 12. The evaluation methodology shows a holistic nutrition practitioner reviewing two distinct client profiles. One client presents with a history of chronic inflammation and digestive distress, expressing a strong belief in the energetic properties of foods and a desire for a diet focused on vibrational alignment. The second client also experiences chronic inflammation and digestive issues, but is primarily concerned with measurable biochemical markers and seeks interventions supported by robust clinical trials. Which of the following approaches best reflects the core philosophies of holistic nutrition in addressing these distinct client needs? Option A. For the first client, prioritize dietary recommendations that emphasize foods known for their perceived high vibrational energy, while for the second client, focus exclusively on supplements and dietary changes with extensive peer-reviewed research demonstrating efficacy for inflammation and digestion. Option B. For the first client, focus solely on the client's belief in energetic properties of food, recommending a diet devoid of any foods with perceived low vibration. And for the second client, dismiss their interest in biochemical markers as being too reductionist for a holistic approach. Option C. For the first client, recommend a strict elimination diet based on ancient healing traditions, and for the second client, suggest a ketogenic diet to rapidly reduce inflammation, irrespective of their individual preferences or potential contraindications. Option D. For both clients, integrate dietary recommendations that address the interconnectedness of physical, mental, and emotional well-being, tailoring interventions to each individual's unique biochemical needs, lifestyle, and personal beliefs, while grounding recommendations in evidence-informed practices. The correct answer is A. For the first client, prioritize dietary recommendations that emphasize foods known for their perceived high vibrational energy, while for the second client, focus exclusively on supplements and dietary changes with extensive peer-reviewed research demonstrating efficacy for inflammation and digestion. Explanation. The evaluation methodology shows a scenario where a holistic nutrition practitioner must navigate differing philosophical underpinnings of holistic health. This is professionally challenging because the BCHN certification emphasizes a broad understanding of holistic principles, requiring practitioners to integrate various schools of thought while adhering to ethical and professional standards. The core challenge lies in discerning which philosophical approach aligns best with evidence-informed practice and client well-being, without overstepping professional boundaries or making unsubstantiated claims. Correct approach represents best professional practice because it acknowledges the interconnectedness of mind, body, and spirit, a foundational tenet of holistic nutrition, while grounding recommendations in scientific understanding and respecting individual client autonomy. It prioritizes personalized care, recognizing that what works for one individual may not work for another, and that a holistic practitioner's role is to guide and educate, not to dictate. This approach is ethically sound and aligns with the BCHN commitment to evidence-informed, client-centered care. An incorrect approach that solely emphasizes a single, unproven modality without considering scientific evidence or client individuality fails to meet the comprehensive standards of holistic nutrition. This could lead to ineffective or even harmful recommendations, violating the ethical obligation to do no harm. Another incorrect approach that dismisses the importance of the client's subjective experience and emotional well-being in favor of purely objective, biochemical markers neglects the holistic aspect of health, reducing the individual to a set of data points rather than a whole person. This also fails to align with the BCHN core philosophy. A third incorrect approach that promotes a rigid, one-size-fits-all dietary plan, regardless of individual needs, preferences, or cultural background, disregards the personalized nature of holistic care and can be alienating and ineffective. Professionals should approach such situations by first understanding the client's unique context, including their health history, lifestyle, beliefs, and goals. They should then draw upon a broad base of knowledge, integrating scientific evidence with established holistic principles. Recommendations should be presented as options, with clear explanations of potential benefits and risks, empowering the client to make informed decisions. Continuous learning and a commitment to ethical practice are paramount. Question 13. Quality control measures reveal that a holistic nutrition professional is developing client action plans. Which of the following best describes the appropriate scope of practice for this professional in relation to these plans, strictly adhering to the BCHN framework? Option A. Offering advice on medical conditions and prescribing specific dietary regimens to manage symptoms, without requiring the client to consult a physician. Option B. Providing clients with a list of supplements to cure specific ailments, based on anecdotal evidence and personal testimonials. Option C. Creating detailed meal plans with precise macronutrient and micronutrient targets for clients with diagnosed chronic illnesses, including specific therapeutic dietary interventions. Option D. Developing personalized wellness plans that integrate dietary recommendations, stress management techniques, and lifestyle adjustments, while educating clients on their role in achieving optimal health and referring them to other healthcare professionals for medical diagnosis or treatment. The correct answer is D. Developing personalized wellness plans that integrate dietary recommendations, stress management techniques, and lifestyle adjustments, while educating clients on their role in achieving optimal health and referring them to other healthcare professionals for medical diagnosis or treatment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a holistic nutrition professional to navigate the boundaries of their scope of practice while adhering to specific regulatory frameworks. The risk lies in overstepping these boundaries, potentially providing advice that falls outside their expertise or is not supported by evidence-based holistic nutrition principles, which could lead to client harm or regulatory noncompliance. Careful judgment is required to distinguish between general wellness guidance and specific medical or therapeutic interventions. Correct approach analysis. The correct approach represents best professional practice because it aligns with the definition and scope of holistic nutrition as understood within the board's Certified in Holistic Nutrition (BCHN) framework. This involves focusing on the interconnectedness of physical, mental, emotional, and environmental factors influencing well-being, and providing guidance on nutrition, lifestyle, and stress management. It emphasizes education and empowerment, guiding clients toward making informed choices that support their overall health without diagnosing or treating specific medical conditions. This approach respects the client's autonomy and the professional's defined expertise, ensuring services are delivered ethically and within regulatory guidelines. Correct approach is analysis, an approach that involves diagnosing or treating specific medical conditions, such as recommending dietary protocols for diabetes or autoimmune diseases without being a licensed medical professional, represents a significant regulatory and ethical failure. This oversteps the scope of practice for a holistic nutrition professional and encroaches upon the domain of licensed healthcare providers, potentially leading to misdiagnosis, delayed medical treatment, and harm to the client. It violates ethical principles of competence and professional boundaries. An approach that solely focuses on macronutrient and micronutrient calculations without considering the client's lifestyle, stress levels, or environmental influences fails to embody the holistic principles of the profession. While nutritional science is a component, a holistic approach necessitates a broader perspective. This narrow focus may lead to incomplete or ineffective recommendations, as it neglects crucial interconnected factors that impact health and well-being, thereby not fully serving the client within the holistic framework. An approach that relies on unsubstantiated or pseudoscientific claims without evidence-based support is an ethical failure. Holistic nutrition, while encompassing a wide range of practices, must be grounded in credible research and established principles. Promoting unproven methods can mislead clients, waste their resources, and potentially cause harm by diverting them from evidence-based care. This violates the ethical obligation to provide competent and responsible guidance. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of their defined scope of practice, as outlined by the BCHN. This involves self-assessment of knowledge and skills and a commitment to continuous learning. When faced with a client's needs, professionals should ask, does this request fall within the established definition and scope of holistic nutrition? If the request involves medical diagnosis, treatment, or advice that requires licensure, the professional must recognize this boundary and refer the client to an appropriate licensed healthcare provider. The focus should always be on empowering the client through education and lifestyle guidance that supports their overall well-being, respecting the interconnectedness of mind, body, and environment, and adhering to evidence-based practices. Question 14. Research into optimal infant nutrition for a 6-month-old exclusively breastfed infant who is showing signs of readiness for solids reveals that the parents are interested in incorporating a variety of nutrient-dense foods. They have also expressed concerns about potential toxins in the environment and are seeking ways to cleanse their baby system. Considering established pediatric nutrition guidelines and the infant's developmental stage, which of the following approaches best supports the infant's health and development while addressing parental concerns responsibly? Option A. Recommend introducing cow's milk as a primary beverage to provide essential nutrients and support the infant's developing system. Option B. Advise a strict vegan diet for the infant, emphasizing plant-based sources of protein and nutrients, and suggest herbal teas for detoxification. Option C. Suggest a regimen of specific herbal tinctures and a juice-based detox plan to cleanse the infant's system before introducing any solid foods. Option D. Introduce single-ingredient purees of iron-rich foods, such as pureed meats or fortified infant cereals, alongside continued breastfeeding, and discuss the importance of a balanced diet for overall health rather than focusing on cleansing. The correct answer is D. Introduce single-ingredient purees of iron-rich foods, such as pureed meats or fortified infant cereals, alongside continued breastfeeding, and discuss the importance of a balanced diet for overall health rather than focusing on cleansing. Explanation. This scenario presents a common challenge for holistic nutrition professionals, navigating the complexities of infant feeding recommendations while adhering to established, evidence-based guidelines and regulatory frameworks. The professional must balance the desire to offer personalized, holistic advice with the absolute necessity of ensuring infant safety and promoting optimal development, which are paramount in this vulnerable population. The challenge lies in distinguishing between evidence-based best practices and anecdotal or less supported approaches, particularly when parents express concerns or preferences that may deviate from standard recommendations. The correct approach represents best professional practice because it prioritizes the infant's health and safety by grounding recommendations in established scientific consensus and regulatory guidance for infant nutrition. This includes understanding the critical role of breast milk or infant formula as the primary source of nutrition for the first year of life, the appropriate timing and introduction of solid foods, and the avoidance of potentially harmful substances or practices. Adherence to these principles aligns with the ethical obligations of a nutrition professional to provide evidence-based, safe, and effective guidance, thereby protecting the infant from nutritional deficiencies, allergies, or other adverse health outcomes. Furthermore, it upholds the professional's responsibility to educate parents on established guidelines, empowering them to make informed decisions that support their child's well-being. An incorrect approach that suggests introducing cow's milk as a primary beverage before 12 months of age represents a significant regulatory and ethical failure. Cow's milk is not nutritionally appropriate for infants under 1 year due to its high protein and mineral content, which can strain an infant's immature kidneys, and its low iron content, which can contribute to iron deficiency anemia. This recommendation directly contradicts established pediatric nutrition guidelines and could lead to serious health consequences for the infant. Another incorrect approach that involves recommending a strict vegan diet for an infant without careful planning and supplementation is also ethically problematic. While a well-planned vegan diet can be healthy for children, infants have specific nutrient needs, particularly for vitamin B12, iron, vitamin D, calcium, and omega-3 fatty acids, which are crucial for growth and development. Omitting animal products without ensuring adequate intake of these nutrients through fortified foods or supplements can lead to deficiencies that have long-term developmental impacts. This approach fails to meet the standard of care for infant nutrition, which emphasizes ensuring all essential nutrients are met. A third incorrect approach that focuses solely on detoxifying an infant system through specific herbal remedies without considering the infant's developmental stage and nutritional needs is a clear ethical and potentially regulatory violation. Infants have developing digestive and metabolic systems, and the administration of unproven or potentially harmful substances can be dangerous. Holistic nutrition professionals are expected to provide guidance that is safe, evidence-based, and appropriate for the age and developmental stage of the child, rather than relying on unsubstantiated claims. The professional decision-making process for similar situations should involve a thorough assessment of the infant's current feeding practices, developmental milestones, and any parental concerns. The professional must then consult and adhere to current, evidence-based guidelines from reputable organizations such as the American Academy of Pediatrics (OP) and relevant national health bodies. This includes understanding the recommended age for introducing solids, the types of foods to introduce, and the importance of breast milk or infant formula. Any recommendations must be communicated clearly to parents, explaining the rationale behind them and addressing any questions or concerns with accurate, evidence-based information. The professional must also be aware of their scope of practice and refer to pediatricians or registered dietitians when necessary, especially in cases of medical conditions or complex nutritional needs. Question 15. The performance metrics show a client consistently reporting bloating, gas, and irregular bowel movements, despite adhering to a generally healthy, balanced diet. The client expresses frustration with the lack of improvement and is seeking personalized strategies to alleviate their digestive discomfort. Option A. Recommend a broad-spectrum probiotic and digestive enzyme supplement regimen to address general gut dysbiosis and aid in nutrient breakdown. Option B. Suggest the client drastically reduce their intake of all carbohydrates and fats for a period to see if this alleviates symptoms. Option C. Implement a structured elimination diet, systematically removing common trigger foods and then reintroducing them one by one under professional guidance to identify specific sensitivities. Option D. Advise the client to immediately seek a medical diagnosis from a gastroenterologist for potential underlying gastrointestinal conditions. The correct answer is C. Implement a structured elimination diet, systematically removing common trigger foods and then reintroducing them one by one under professional guidance to identify specific sensitivities. Explanation. The performance metrics show a client experiencing persistent digestive discomfort despite following a general healthy eating plan. This scenario is professionally challenging because it requires the holistic nutrition professional to move beyond generalized advice and delve into the nuanced interplay of diet, lifestyle, and individual physiology impacting digestive health. The BCHN certification emphasizes a comprehensive, client-centered approach, necessitating careful consideration of potential underlying causes and appropriate interventions within the scope of practice. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment to identify specific triggers and contributing factors to the client's digestive issues. This aligns with the BCHN commitment to evidence-informed, personalized nutrition care. By recommending a structured elimination diet under professional guidance, the practitioner is employing a recognized, safe, and effective method for identifying food sensitivities or intolerances. This approach respects the client's autonomy while ensuring their safety and maximizing the potential for positive outcomes. It also adheres to ethical guidelines by not making unsubstantiated claims or providing advice outside the scope of holistic nutrition practice. An incorrect approach that involves recommending a broad spectrum of supplements without a targeted assessment fails to address the root cause of the digestive distress. This could lead to unnecessary expense for the client, potential adverse interactions, and a delay in identifying the actual dietary triggers. Ethically, it borders on unsubstantiated claims if the supplement recommendations are not directly linked to identified deficiencies or specific, evidence-based interventions for the client's symptoms. Another incorrect approach, suggesting the client consult a medical doctor for a definitive diagnosis without first conducting a comprehensive nutritional assessment, bypasses the core expertise of a holistic nutrition professional. While collaboration with medical professionals is crucial, the initial step in a nutrition consultation should be to leverage the practitioner's skills to gather nutritional information and propose relevant dietary strategies. This approach fails to fully utilize the practitioner's scope of practice and may prematurely defer responsibility. Finally, recommending drastic dietary changes without a systematic approach, such as a phased elimination and reintroduction process, can be overwhelming for the client and may not yield clear results, potentially leading to frustration and non-adherence. This lacks the precision and client support essential for effective nutritional intervention. Professionals should employ a decision-making framework that begins with active listening and detailed client history taking, focusing on symptoms, dietary patterns, lifestyle, and stress levels. This is followed by a comprehensive nutritional assessment, which may include food diaries and symptom logs. Based on this assessment, the practitioner identifies potential contributing factors and formulates a personalized plan, which might involve dietary modifications, lifestyle adjustments, or targeted supplementation. Crucially, the practitioner must operate within their scope of practice, recognizing when to refer to other healthcare professionals for medical diagnosis or specialized care. Question 16. The audit findings indicate that a client has expressed significant distress regarding their mood and energy levels, attributing these issues to their diet. The holistic nutrition professional is reviewing their approach to this client's case. Which of the following represents the most ethically sound and professionally responsible course of action? Option A. Provide a comprehensive nutritional plan designed to directly address the client's reported mood and energy issues, including specific micronutrient recommendations and lifestyle adjustments aimed at improving mental well-being. Option B. Acknowledge the client's concerns, offer general evidence-based nutritional guidance that supports overall well-being, and strongly recommend a consultation with a licensed mental health professional for a thorough assessment and appropriate support. Option C. Recommend a series of specialized supplements and detoxification protocols that are anecdotally reported to improve mood and energy without consulting external professional resources. Option D. Advise the client that nutrition plays a minimal role in mental health and focus solely on macronutrient balance for physical energy, suggesting they seek medical advice for their mood concerns. The correct answer is A. Provide a comprehensive nutritional plan designed to directly address the client's reported mood and energy issues, including specific micronutrient recommendations and lifestyle adjustments aimed at improving mental well-being. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the holistic nutrition professional to navigate the complexities of client autonomy, limitations of their scope of practice, and the potential for misinterpretation of scientific information when addressing mental health concerns. The audit findings highlight a need for improved client communication and adherence to ethical guidelines, particularly when dealing with sensitive topics like mental well-being. The professional must balance providing supportive, evidence-informed guidance with recognizing when to refer to other healthcare professionals. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the client's well-being and safety. It involves acknowledging the client's concerns, providing evidence-based nutritional information relevant to mental health, and crucially, recognizing the limitations of the holistic nutrition scope of practice. This approach aligns with ethical principles of competence and professional boundaries, ensuring that the client receives appropriate care. Specifically, it adheres to the BCHN commitment to evidence-informed practice and the ethical imperative to refer clients to qualified mental health professionals when their needs extend beyond the scope of nutrition support. This upholds the integrity of the profession and protects the client from unqualified advice. Incorrect approaches analysis. One incorrect approach fails by overstepping the scope of practice, providing specific diagnoses or treatment plans for mental health conditions, even with nutritional recommendations, constitutes practicing outside the defined boundaries of holistic nutrition and encroaches upon the domain of licensed mental health professionals. This is a direct violation of ethical guidelines that mandate practitioners operate within their areas of expertise and competence. Another incorrect approach is to dismiss or minimize the client's mental health concerns. This demonstrates a lack of empathy and professional responsibility. Ethical practice requires a holistic view of the client, acknowledging the interconnectedness of physical and mental health. Ignoring or downplaying mental health issues can lead to delayed or inadequate care for the client. A further incorrect approach involves providing unsubstantiated or pseudoscientific nutritional advice for mental health. This not only lacks evidence-based support, but can also be harmful, potentially leading clients to abandon conventional treatments or adopt ineffective strategies. This directly contradicts the BCHN emphasis on evidence-informed practice and can erode client trust. Professional reasoning. When faced with a client presenting with mental health concerns, a holistic nutrition professional should first actively listen and acknowledge the client's experience. They should then assess if their scope of practice can ethically and effectively address the nutritional aspects related to the client's stated concerns, always grounding recommendations in scientific evidence. A critical step is to clearly define the boundaries of their role and to proactively identify when a referral to a licensed mental health professional is necessary. This involves open communication with the client about the referral and, with client consent, facilitating the transition of care. This decision-making process prioritizes client safety, ethical conduct, and the collaborative nature of healthcare. Question 17. Which approach would be most appropriate for a board-certified in holistic nutrition, BCHN, practitioner to comprehensively assess a new client's nutritional status and overall well-being, considering the holistic nature of their practice and the need for ethical and effective client care? Option A. Utilizing unvalidated bioresonance scanning technology to identify specific nutrient deficiencies and imbalances, and then creating an intervention plan based on the scanner's output. Option B. A comprehensive intake process that includes a detailed dietary history, symptom questionnaires, lifestyle factor assessment, and a review of relevant health records, followed by a personalized plan based on the gathered information. Option C. Relying primarily on a single, widely available food frequency questionnaire to quickly gauge the client's typical food intake, and then developing recommendations based solely on that data. Option D. Conducting a physical examination to diagnose specific medical conditions related to nutrition and prescribing pharmaceutical interventions to address those conditions. The correct answer is B. A comprehensive intake process that includes a detailed dietary history, symptom questionnaires, lifestyle factor assessment, and a review of relevant health records, followed by a personalized plan based on the gathered information. Explanation. This scenario presents a professional challenge because a holistic nutrition practitioner must navigate the complexities of client assessment while adhering to the ethical and regulatory standards set forth by the board certified in holistic nutrition, BCHN. The core challenge lies in selecting the most appropriate and comprehensive clinical assessment method that respects client autonomy, ensures data integrity, and aligns with the scope of practice for a holistic nutrition professional. Careful judgment is required to avoid overstepping professional boundaries or relying on methods that lack scientific validity or ethical grounding within the BCHN framework. The correct approach represents best professional practice because it prioritizes a multifaceted assessment that integrates subjective client reporting with objective data, all within the scope of holistic nutrition. This approach acknowledges that a client's health is influenced by a wide array of factors beyond just diet, including lifestyle, environment, and emotional well-being. By utilizing a combination of detailed dietary intake analysis, symptom questionnaires, and lifestyle factor exploration, the practitioner can develop a holistic understanding of the client's needs. This aligns with BCHN emphasis on a whole-person approach and the ethical imperative to gather sufficient information to provide safe and effective guidance. It also respects the client's role in their own health journey by actively involving them in the reporting process. An incorrect approach that relies solely on a single, narrow assessment tool, such as only a food frequency questionnaire without further context, fails to capture the full picture of a client's health and dietary habits. This could lead to incomplete or inaccurate recommendations, potentially causing harm. Ethically, it may also be considered a failure to adequately assess the client's needs, which is a fundamental responsibility. Another incorrect approach might involve the use of unvalidated or pseudoscientific assessment methods, such as iridology or muscle testing for nutritional deficiencies, without robust scientific backing. This would violate BCHN commitment to evidence-informed practice and could lead to misdiagnosis or inappropriate interventions, posing a significant ethical and professional risk. Furthermore, an approach that involves making medical diagnoses or prescribing treatments outside the scope of holistic nutrition practice would be a clear regulatory and ethical violation, as BCHN certified professionals are not licensed medical practitioners. The professional decision-making process for similar situations should involve a systematic evaluation of available assessment tools against established BCHN ethical guidelines and scope of practice. Practitioners should prioritize methods that are comprehensive, evidence-informed, and client-centered. They must continuously assess the validity and reliability of assessment tools and be prepared to adapt their approach based on the individual client's needs and circumstances, always maintaining a commitment to client safety and well-being. Question 18. The review process indicates that a client who has been working with a board-certified in holistic nutrition, BCHN, professional for several months on a personalized meal plan to manage digestive discomfort, expresses a strong desire to incorporate a highly restrictive, fad diet into their existing plan. The client believes this new diet, which is gaining popularity online and promises rapid results, will accelerate their healing process, despite the professional's initial assessment suggesting it may not be suitable for their specific condition and could potentially exacerbate symptoms. The professional is concerned about the client's well-being and the integrity of the established plan. Option A. The professional should explain to the client, in clear and understandable terms, the potential risks and lack of scientific evidence supporting the fad diet's efficacy for their specific condition, while also exploring alternative modifications to the current meal plan that address the client's desire for change and potential for faster improvement. Ensuring the client understands the rationale behind all recommendations and collaboratively agreeing on a revised plan. Option B. The professional should refuse to discuss the fad diet further, stating that it falls outside the scope of holistic nutrition and is not evidence-based, and insist that the client adhere strictly to the original meal plan without any modifications. Option C. The professional should research the fad diet extensively, and if any positive anecdotal evidence is found online, recommend it to the client as a potential option, while also continuing with the original meal plan to ensure a balanced approach. Option D. The professional should immediately incorporate the fad diet into the client's meal plan as requested, assuming the client is an adult capable of making their own dietary choices, and document the client's explicit consent for this change. The correct answer is A. The professional should explain to the client, in clear and understandable terms, the potential risks and lack of scientific evidence supporting the fad diet's efficacy for their specific condition, while also exploring alternative modifications to the current meal plan that address the client's desire for change and potential for faster improvement. Ensuring the client understands the rationale behind all recommendations and collaboratively agreeing on a revised plan. Explanation. The review process indicates a scenario where a holistic nutrition professional is faced with a client's request that potentially conflicts with established best practices and ethical considerations within the scope of practice for boards certified in holistic nutrition, BCHN, professionals. This situation is professionally challenging because it requires balancing client autonomy and preferences with the responsibility to provide safe, evidence-informed, and ethical guidance. The professional must navigate potential conflicts between a client's desires and what is considered appropriate within the BCHN framework, which emphasizes a holistic, client-centered approach grounded in scientific understanding and ethical conduct. The correct approach involves a thorough assessment of the client's request, followed by an open and honest discussion about the feasibility, safety, and potential efficacy of the proposed meal plan modifications. This approach represents best professional practice because it upholds the BCHN commitment to client well-being, informed consent, and professional integrity. It involves educating the client about the rationale behind recommended practices, exploring alternative solutions that align with their goals while remaining within safe and ethical boundaries, and documenting all discussions and decisions. This respects the client's agency while ensuring the professional acts responsibly and within their scope. An incorrect approach would be to immediately agree to the client's request without proper evaluation, potentially leading to unsafe or ineffective dietary interventions. This fails to uphold the professional's duty of care and could violate ethical guidelines regarding competence and scope of practice. Another incorrect approach would be to dismiss the client's request outright without attempting to understand their underlying motivations or explore compromises, which could damage the therapeutic relationship and fail to meet the client's holistic needs. A third incorrect approach would be to provide a meal plan that relies on unsubstantiated claims or unproven methods, which directly contravenes the BCHN emphasis on evidence-informed practice and could mislead the client. Professionals should approach such situations by first actively listening to and understanding the client's request and the reasons behind it. This should be followed by a comprehensive assessment of the client's health status, goals, and preferences. The professional then uses their knowledge and expertise to evaluate the request against established nutritional science and ethical guidelines. Open communication, education, and collaborative decision-making are paramount. If a request cannot be safely or ethically accommodated, the professional should clearly explain why, offer alternative strategies, and if necessary, refer the client to another qualified professional. Question 19. The analysis reveals that a client experiencing chronic fatigue is seeking comprehensive support, including dietary adjustments and specific herbal recommendations. As a board certified in holistic nutrition, BCHN, what is the most appropriate and ethically sound approach to address the client's interest in herbal medicine? Option A. Provide general educational information about common herbs associated with energy support and potential interactions, while strongly advising the client to consult with a licensed herbalist or qualified healthcare provider for personalized herbal recommendations. Option B. Research and prescribe a custom herbal formula for the client's chronic fatigue, assuming that holistic nutrition encompasses the practice of herbalism. Option C. Focus exclusively on dietary modifications and nutritional supplements, and inform the client that herbal medicine falls outside the scope of holistic nutrition practice. Option D. Directly recommend specific herbal supplements known for their adaptogenic properties and energy-boosting effects, based on general knowledge of herbal actions. Correct answer is A. Provide general educational information about common herbs associated with energy support and potential interactions, while strongly advising the client to consult with a licensed herbalist or qualified healthcare provider for personalized herbal recommendations. Explanation. The analysis reveals a scenario where a holistic nutrition professional is asked to recommend specific herbal supplements for a client experiencing chronic fatigue, alongside dietary adjustments. This situation is professionally challenging because it straddles the line between nutritional advice and the practice of herbal medicine, which may have different regulatory oversight depending on the jurisdiction. The professional must navigate the scope of practice for holistic nutritionists, ensuring they do not overstep into areas requiring licensure as a herbalist or medical practitioner, while still providing comprehensive and safe support. The correct approach represents best professional practice because it prioritizes client safety and adheres to the established scope of practice for a board certified in holistic nutrition, BCHN. This involves focusing on evidence-based nutritional interventions and general wellness strategies that fall within the BCHN purview. When considering herbal support, the professional's role is to educate the client about general benefits and potential interactions with diet and conventional medications, and to strongly recommend consultation with a qualified and licensed herbalist or healthcare provider for specific herbal recommendations. This ensures that the client receives expert guidance on herbal therapies, minimizing risks associated with improper use, contraindications, or interactions. This aligns with ethical principles of professional responsibility and client well-being, and implicitly respects regulatory boundaries by not offering prescriptive herbal advice. An incorrect approach that involves directly recommending specific herbal supplements for the client's chronic fatigue without referral to a qualified herbalist represents a significant regulatory and ethical failure. This could be construed as practicing herbal medicine without appropriate licensure or certification, depending on the specific regulations governing herbal practice in the relevant jurisdiction. Ethically, it violates the principle of do no harm by potentially exposing the client to risks of adverse effects, interactions, or ineffective treatment due to a lack of specialized knowledge and regulatory authorization. Furthermore, it fails to uphold professional integrity by operating outside of one's defined scope of practice. Another incorrect approach, which is to dismiss the client's interest in herbal medicine entirely and focus solely on diet, is also professionally suboptimal. While staying within scope is crucial, completely disregarding a client's expressed interest in complementary therapies can hinder rapport and limit the potential for holistic support. A more effective approach would acknowledge the client's interest and then guide them toward appropriate professional consultation for that specific modality. The professional decision-making process for similar situations should involve a clear understanding of one's scope of practice, as defined by the BCHN certification and any applicable state or national regulations. When a client presents with a condition or requests support that falls outside this scope, the professional's primary responsibility is to educate the client about their limitations and to facilitate access to qualified practitioners in the relevant field. This involves active listening, clear communication about what can and cannot be provided, and providing resources or referrals to appropriate specialists. The decision-making framework should always prioritize client safety, ethical conduct, and adherence to regulatory guidelines. Question 20. Stakeholder feedback indicates a growing interest in incorporating specific functional foods into daily diets for enhanced well-being. A client presents with a desire to improve their cardiovascular health and asks for guidance on whether a particular fermented beverage, marketed for its probiotic content and purported cholesterol-lowering effects, is a suitable addition to their diet. Considering the BCHN scope of practice and ethical guidelines, which approach best addresses this client's inquiry? Option A. Advise the client to immediately incorporate the fermented beverage into their diet as a primary strategy for improving cardiovascular health, based on the product's marketing claims and anecdotal testimonials. Option B. Recommend the fermented beverage based on its popularity and general reputation for health benefits, without delving into specific scientific evidence or considering the client's individual circumstances. Option C. Recommend the fermented beverage after reviewing current scientific literature on its specific probiotic strains and their documented impact on cholesterol levels, while also assessing its compatibility with the client's overall dietary pattern and existing health conditions. Option D. Suggest that the client consult with their physician for all dietary recommendations related to cardiovascular health, without providing any nutritional guidance on functional foods. The correct answer is C. Recommend the fermented beverage after reviewing current scientific literature on its specific probiotic strains and their documented impact on cholesterol levels, while also assessing its compatibility with the client's overall dietary pattern and existing health conditions. Explanation. This scenario is professionally challenging because it requires a holistic nutrition professional to navigate the nuanced landscape of functional foods, balancing scientific evidence with client-specific needs and potential regulatory considerations, all while adhering to the strict ethical and professional standards of the Board Certified in Holistic Nutrition, BCHN. The core challenge lies in discerning between scientifically supported benefits and unsubstantiated claims, particularly when stakeholders may have varying levels of understanding or be influenced by marketing. The correct approach represents best professional practice because it prioritizes evidence-based recommendations and client-centered care. A BCHN professional is ethically bound to provide accurate, science-backed information and to tailor recommendations to the individual's health status, dietary patterns, and goals. This involves a thorough assessment of the client's needs and a critical evaluation of the functional food's purported benefits, ensuring that any advice aligns with established nutritional science and promotes overall well-being without making unsubstantiated health claims. This approach upholds the integrity of the profession and ensures client safety and efficacy. An incorrect approach that relies solely on anecdotal evidence or marketing claims is professionally unacceptable. This failure stems from a lack of critical evaluation and a disregard for evidence-based practice, which is a cornerstone of holistic nutrition. It can lead to misinformed recommendations, potentially causing harm to the client if the functional food is ineffective or interacts negatively with their health condition or other treatments. Furthermore, making unsubstantiated health claims about functional foods can violate ethical guidelines and potentially fall outside the scope of practice for a holistic nutritionist, depending on specific regulatory definitions of health claims. Another incorrect approach that focuses on a single functional food without considering the client's overall dietary pattern and existing health conditions is also professionally flawed. Holistic nutrition emphasizes the interconnectedness of diet, lifestyle, and well-being. Isolating a single food without context ignores this fundamental principle and can lead to an unbalanced dietary approach. It fails to address the client's broader nutritional needs and may overlook potential contraindications or synergistic effects with other foods or supplements. The professional decision-making process for similar situations should involve a systematic approach. 1. Client assessment. Thoroughly understand the client's health history, current diet, lifestyle, goals, and any specific concerns. 2. Evidence review. Critically evaluate the scientific literature supporting the purported benefits of any functional food in question. Distinguish between robust research and preliminary or anecdotal findings. 3. Regulatory awareness. Be mindful of any regulations pertaining to health claims for foods or dietary supplements within the relevant jurisdiction. Avoid making definitive medical claims. 4. Individualization. Tailor recommendations to the client's unique needs, considering potential interactions, allergies, and preferences. 5. Education and empowerment. Educate the client about the functional food, its potential benefits, limitations, and how it fits into their overall dietary plan. Empower them to make informed choices. 6. Professional boundaries. Operate within the scope of practice for a holistic nutrition professional, referring to medical practitioners for diagnosis and treatment of diseases.